All right, let's dive into something that isn't just a simple eye irritation. We're talking about a real medical emergency, a situation where every single second counts when it comes to saving someone's sight. We're going deep on corneal ulcers. It might sound a little over the top, but it's the absolute truth. Think about it. A tiny speck of dust, or a contact lens that wasn't cleaned properly. That's all it takes to break through the delicate shield that protects your vision. And once that barrier is breached, microscopic invaders can set up shop. And that can lead to an infection with some pretty devastating consequences. The stakes really couldn't be higher. So, how does this whole battle for your sight even begin? Let's take a look at the very first, most alarming signs that tell you something is seriously wrong with the front of your eye. I want you to imagine this for a second. You look in the mirror and you see a painful white spot right there on your eye. Your vision's getting blurry and even the smallest amount of light feels agonizing. This is absolutely not something you can just ignore or hope goes away. This is the classic way a corneal ulcer shows up. So, what in the world is a corneal ulcer? Well, at its very core, it's a break in the cornea's defenses. It's a loss of that protective surface layer, the epithelium, combined with some serious inflammation right underneath. A really good way to think about it is like an open, infected wound right on the window of your eye. Okay, so here's a really key distinction in medicine that's important to understand. What you feel, the pain, the redness, the blurry vision, those are called symptoms. But what a doctor actually sees when they use their instruments, like the real tissue damage, that's called a sign. And piecing both of those together is absolutely crucial for getting the right diagnosis. You're going to feel a whole range of things. There's intense pain, almost like something is physically stuck in your eye. Your eye will just water like crazy. Your vision gets hazy. And that word photophobia, it's way more than just being sensitive to light. We're talking about actual pain caused by bright light, because it triggers a spasm in the muscles inside your eye. An ophthalmologist, on the other hand, is looking for a very specific set of clues. They'll see redness that's really concentrated right around the cornea. They'll use a special dye called fluorescein, which makes that open sore glow, highlighting it vividly. They'll spot what's called an infiltration, that grayish haze, which is really just a big pileup of inflammatory cells. And in the really bad cases, they might see a hypion, which is a layer of white blood cells that have actually settled down inside the eye. Now, spotting the ulcer is one thing, but if you want to treat it the right way, you have got to know what's causing it. So the next critical step is to figure out which microscopic invader is responsible for this whole mess. There's a technical term for this, and it's etiology. It's basically the detective work of medicine. Is it a bacteria? Is it a fungus? Maybe a parasite? The answer to that question determines the entire treatment plan. And honestly, it can be the difference between saving someone's sight and, well, not. You see, our cornea's surface is a fantastic shield, but it's not invincible. Physical trauma is a huge cause, especially getting poked with something organic, like a plant branch, because that can shove fungus directly into the eye. And not taking care of your contact lenses properly, that is a massive risk factor. Even things like having dry eyes or using steroid eye drops for too long can weaken the cornea's defenses and just open the door for an infection to walk right in. And right here, you can see the two main culprits side by side. On the left, bacterial ulcers often look kind of soupy and really aggressive. But on the right, fungal ulcers, they tend to have these distinct features that a doctor's trained to look for: a drier look, these sort of feathery borders, and sometimes these smaller satellite spots of infection around the main one. So how do doctors confirm what they think is going on? Well, it's not guesswork. Taking a corneal scraping is pretty much mandatory. An ophthalmologist will very carefully take a sample from the ulcer's edge and its base. Then that tiny sample gets stained. They use gram stain for bacteria and something called KOH for fungus, and they look at it under a microscope. It also gets sent to a lab to be cultured, which lets the specific bug grow so they can confirm exactly what it is and figure out which drugs will kill it. Okay, let's zoom way in and see what's actually happening at a cellular level, because this isn't just a surface problem. This is a full-blown war taking place inside the incredibly delicate layers of the cornea. This whole battle really unfolds in 3 stages. First up is the progressive stage. The bad guys multiply, your immune cells rush in, creating that hazy infiltration we talked about, and corneal tissue actually starts to die. That's called necrosis. Then, if the treatment and your body's defenses start working, you hit the regressive stage, where the infection gets contained. And finally, you have cicatrization, which, is a fancy word for scarring. The body just starts laying down fibrous tissue to patch up the hole. Hey, remember that hypopyon we mentioned earlier? Well, here's the textbook definition. It's a collection of specific white blood cells called, get ready for it, polymorphonuclear leukocytes. It's a total mouthful, but all it really means is white blood cells with a funny-shaped nucleus. They pour out from inflamed blood vessels inside the eye because they're responding to the infection's toxins. Seeing this is a clear sign that there's severe inflammation going on inside. And get this, not all hypopyons are the same. A bacterial one, it's often fluid, kind of liquidy, and it'll actually shift around when the patient moves their head. But a fungal hypopyon, oh, that's a different story. It's often thick, immobile, almost like glue. And that is a sinister sign because it suggests the fungal hyphae, the little branching arms of the fungus, have actually invaded the inside of the eye itself. So, the diagnosis is in. The invader has been identified. Now it is time to fight back. And the treatment for a corneal ulcer is aggressive, it is intensive, and it requires a whole arsenal of medical weapons. The core strategy here has a few different parts. First, you've got antimicrobials to kill the invader. For bacteria, this often means using fortified antibiotics. They're specially mixed to be way stronger than normal eye drops. For fungus, you're looking at drugs like natamycin. Next, cycloplagics like atropine are used. These drops paralyze the eye's internal focusing muscles to stop that intense spasming pain. And finally, you have treatments for comfort, like local heat and pain meds. Now, what about steroids? They're amazing at crushing inflammation, but in this situation, they are truly a double-edged sword. If you use them at the wrong time, they can actually suppress the immune system, slow down healing, and make the infection even worse. They are only ever used once the infection is clearly under control and always under the super careful watch of a specialist. You know, even when the infection is finally beaten, the battle isn't really over. The cornea has been damaged, and the aftermath can bring its own set of challenges that can still threaten a person's sight. One of the most terrifying complications is something called descemetocele. This is what happens when the ulcer eats through almost the entire cornea, leaving only the very last innermost layer, Descemet's membrane. You can see it right here, bulging forward because of the eye's natural pressure. The eye is, quite literally, on the verge of rupturing. And this is what happens when that thin membrane finally gives way, a perforation. The ulcer has punched a hole all the way through. The fluid inside the eye rushes out, and you can see here how the iris gets sucked forward to plug the hole. This is a catastrophic event. It can lead to an infection of the entire eye, a condition called endophthalmitis, and potentially the complete loss of the eye itself. But even a so-called healed ulcer doesn't mean it's a total victory. The scar tissue that the body uses to patch the wound isn't clear like the original cornea, it's opaque. It permanently blocks or distorts light, affecting vision forever, especially if that scar is right in the center. For a lot of people, the only way to get clear sight back is with a corneal transplant. And all of this brings us to one last, really crucial thought. That clear window at the front of your eye, the one that does most of the focusing, it's only about 0.5 millimeter thick. It's an unbelievable piece of biological engineering, but it is also incredibly fragile. So after everything we've just gone through, the question's pretty simple. What are you doing to protect it?